Good day to all. Welcome to the midterms, and this is our first topic. Neoplasia. In neoplasia, you will learn about the different terminologies associated with it, the epidemiology or its incidence, the genetics of neoplasia, certain agents that can cause cancer, and the clinical setting of neoplasia. First, the definition of neoplasia. Neo means new, and plasia means growth. So a neoplasia is a new growth or otherwise known as a tumor or neoplasm. And neoplasms or tumors can either be benign, not cancer, or malignant, cancer, and the study of cancer is oncology, as oncos means cancer, and logi means to study. It is very important to know that just like normal tissue, from where neoplasms or tumors originate or grow from, tumors have a parenchyma and a supporting stroma. And as the parenchyma transforms into a neoplasm, the stroma becomes fibrotic, or becomes desmoplastic. But there are some tumors that have less fibrosis, and are more fleshy. Tumors are classified into the following. And when tumors are benign, they end in the suffix -oma. But there are tumors that end in -oma, that are not benign. Examples of epithelial tumors are those made of glands and those made of squamous cells. The word -ata is added to the suffix -oma to name a benign glandular tumor. Thus a benign glandular tumor is called an adenoma. If a benign tumor is made up of squamous cells lining finger-like projections or papillae, it is a squamous papilloma. Mesenchymal tumors that are benign are more simple to name. Just add the suffix -oma to the type of tissue that became a benign neoplasm. For example, if it is from the cartilage, which is made up of chondrocytes, it is called a chondroma. If it is made of smooth muscles, it is a leiomyoma. And this is how you name malignant tumors. Just remember that if it is epithelial, you add the term carcinoma. If it is mesenchymal, you add the term sarcoma. Again, there are exceptions. Using the following tumors as examples, remember. An adenoma is benign, when malignant, it becomes adenocarcinoma. This is epithelial. A chondroma is benign, when it becomes malignant, it becomes a chondrosarcoma. This is mesenchymal. Review in your histology, the tissues that are classified as epithelial and mesenchymal. This and the next slide will show terms that are related or associated with neoplasia. These are very important in the study of neoplasia as there are certain conditions that are not neoplastic that are considered precursors to the development of malignancy. One example is the disease Barrett esophagus, where the normal squamous lining of the esophagus was transformed into a columnar lining, due to long-term gastroesophageal reflux disease or GERD. Barrett esophagus is a precursor to the development of adenocarcinoma of the esophagus. Briefly, let's talk about the epidemiology of cancer. As you can see, there are many factors that can predispose an individual to the development of neoplasia. Certain neoplasms are common among certain age groups, certain infections can result to malignancies, and genetics play a role. Now a short introduction to the molecular basis of cancer. Remember that we have genes that encode for something. One of them is called a proto-oncogene. Proto-oncogenes participate in the regulation cell growth, which plays a major role in the development of neoplasm. If the proto-oncogenes become mutated, they are now called oncogenes, and play a big role in the neoplasia. Shown here are some of the proto-oncogenes. Please do not forget the p53 gene, the guardian of the genome. This slide shows the characteristics of a malignant tumor that contributes to its development, growth, and spread, in spite of the body's defense against it. In the clinical setting, diagnostic tools, the recognition of its clinical manifestations, its grading and staging are essential in the correct diagnosis and management of neoplasia, especially cancer. That ends our brief discussion for neoplasia. Next topic is disorders of the immune system.